Until recently, if you wanted treatment for heart disease, there have been no alternatives for expensive, invasive procedures such as angioplasty or bypass. But now
there's an alternative that you won't believe.
As CBS's John Roberts reports tonight, it's not even a pill you have to take. It's something you wear.
Furthermore, the treatment can be used if patients have mild angina or severe angina. Almost an immediate decrease in the episodes of angina.
And this improvement has come without surgery, without the addition of new medications.
Absolutely unbelievable.
It has done remarkably.
I really don't use my Napro at all
And
now.
the beneficial effects have lasted for more than a year.
Hi, I'm Dr. Jim DeSteffens of the ECP Heart Care Center. I want to share with you a revolutionary approach to the treatment of coronary artery disease, in addition to a comprehensive attitude about how it is we go after this #1 killer of Americans today. You know, studies have shown that as many as 12.5 million people are currently suffering from the disabling chest pain that we refer to as angina pectoris. And there's about 500,000 people dying every year. And so today what I want to try to do is to share with you a revolutionary approach from a new procedure that most of you have not had an opportunity to hear about yet, as to how it is that we can actually stimulate the heart to, in effect, heal itself by developing what we refer to as natural bypasses.
The therapy is enhanced external counterpulsation, or EECP. As you can see from this computer image, EECP uses the blood in the vessels of the lower extremities to improve cardiac function. As your heart relaxes, a series of inflatable cuffs apply pressure to vessels in your calves, lower thighs, and upper thighs. The cuffs inflate in sequence, beginning with the ones furthest away from your heart and proceeding upward. This effectively moves both arterial and venous blood toward the heart in a rhythmic motion. Just before your heart begins to contract, the cuffs automatically deflate, causing a rapid drop in vascular resistance. This drop in resistance brings about a decrease in cardiac afterload, or the stress your heart is under. Following repeated sessions with EECP, patients usually establish better coronary artery flow and suffer fewer or less severe angina attacks.
Here's an angiogram or dye study of two hearts that's specifically designed to document the growth of its collateral circulation or natural bypasses through the use of EECP. The picture on your left is before, and the one on the right is after EECP treatment. Now, if you had a critical blockage in one or more of your heart arteries, which pattern of circulation would you like to have in your corner in your fight against coronary artery disease? Now, here's an interesting question that happens frequently, and that is this. Doesn't this procedure put an awful lot of stress on my heart? I've already got a weak heart. I'm having low threshold angina. It doesn't take much to precipitate. Doesn't these pulsations in the legs, doesn't that put extra stress, these pulsations coming up and putting stress on the heart? And the answer to that is absolutely not. And the reason for that is that the timing of these pulsations happens at a very critical timing in the heart cycle. When the heart goes into relaxation phase, that's normally when the heart muscle is filling with blood, as well as at a time at which the coronary arteries, that is the feeder arteries in the heart, also are normally filling. And so consequently, that's when the pulsations occur. That's when this pulse of extra blood comes up to the base of the heart and actually helps to fill out these coronary vessels, the feeder arteries in the heart, much more aggressively than it would be otherwise. In effect, ballooning them out, getting more blood, more oxygen into those feeder arteries. In addition, the same pulse of pressure gets into the heart chambers, allowing the heart muscle, especially if it's in a weakened condition, to be able to fill much more capably than it would without that extra kind of a burst of energy to fill the chamber. Now, once that chamber has been filled and the heart's now ready to pump, then what happens? The cuffs around the legs deflate rapidly. And what that does creates a little bit of a vacuum effect on the other side of the heart, where the blood normally gets pumped into on the other side of the aortic valve. And consequently, a weakened heart is able to then pump blood into a lower pressure system, which makes it a whole lot easier for the heart to be able to then do the work that it needs to be. So contrary to what it might seem, actually it dramatically reduces the stress on the heart. In fact, the likelihood of you having an event or a heart attack or an angina episode will be at its lowest point while you're actually on the machine.
It's a new technique known as EECP. It's been tested right here in Boston with some amazing results.
A new study found that a medical treatment called counterpulsation could offer relief for many of these patients.
A new study offered relief for those who suffer from angina
More now from NBC's Robert Brazell.
So far, doctors in this country have used the device mostly to treat people who cannot undergo angioplasty or bypass surgery to treat their clogged arteries. But if the device continues to work well, it could become much more popular. The biggest problem is that many cardiologists remain skeptical, saying it just seems too good to be true. But it is painless, safe, and as this latest study proves, for some it works wonders.
So if external counterpulsation has been around for over 30 years, why is it that we're now just starting to hear bits and pieces about this? Well, it's really a very interesting question, historically speaking anyway, and let me try to give you some ideas about this. It was really developed initially in the United States, and approximately 30 years or so ago, prior to when bypass surgery even came out. And when cardiologists became interested in developing invasive techniques for the treatment of coronary artery disease, including bypass surgery, heart caths, angioplasties, and stents, the interest in developing this non-invasive approach to the treatment of coronary disease, which was designed primarily to try to stimulate the heart to, in effect, grow its own natural bypasses, became less and less interesting to most cardiologists. So the research began to be developed increasingly abroad. But it was reintroduced again about 10 years ago into multi-center studies across the United States, including prestigious universities such as the Mayo Clinic out of Rochester, University of Pittsburgh, Yale University, as well as other major universities across the United States. Consequently, what they've been able to repeatedly show is that patients with coronary disease and the angina chest pain that is associated with it seem to be improved anywhere between 70 to as much as 85% of the time in terms of the frequency and severity of the angina chest pains, even in patients who have already failed bypass surgery. Now, that's an incredible kind of a finding. The other important thing is that recent studies have also shown that not only does it seem to be effective, but 1 year after the completion of treatment, when we look at patients who had finished treatment, that the numbers of patients who are totally angina-free, that is, we can't stimulate any angina in them, even with exercise tests, the number of patients who were totally angina-free had actually even doubled, even though they were receiving no more external counterpulsation treatments. And so what basically that tells us is that what external counterpulsation is able to do is to initiate or begin a process of healing in the coronaries, where the coronaries begin to expand their circulation to produce these so-called natural bypasses, and apparently that process seems to continue on in significant percentages of people, even when they're not currently having external counterpulsation done.
The EECP procedure gave me the opportunity to get ahead again. This type of procedure for me allowed me to really change my lifestyle. It allowed me a second chance to go back to do the kinds of things, maybe pay a little bit more attention to my diet now, maybe pay a little bit more attention to my weight and exercise programs, so that now I remain ahead of my angina and not behind it.
Here's another really frequently asked question that I get all the time. What's the relative risk of doing this? Well, in properly selected patients, there is absolutely no risk whatsoever. There are a few categories of folks that we can't do this on. People who have recent blood clots in the legs in the last, say, 6 months. People who have uncontrolled high blood pressure or very erratic, irregular heart rhythms. Or people who have a particular heart valve called the aortic valve that has a severe leak in it. Or those folks who have an aneurysm that looks like it is close to needing to be repaired surgically. These are folks that we can't do counterpulsation on because it has some significant potential risks. But if they don't have these sort of things, then there is absolutely no risk associated doing it.
If you, a friend, or loved one suffers from the debilitating affliction known as chronic angina, or if you have previously undergone invasive surgical procedures which have failed to relieve your angina, you should know about EECP.
Before the procedure, I was dominated by fear. I was very afraid. It was very difficult for me to live. After the EECP, rejuvenation, rehabilitation, open-endedness, like, you know, every day is another day to explore and enjoy life.
I think it's a wonderful way to go for someone that is experiencing angina, and I definitely prefer it to having operations and having to lay in the hospital bed for hours at a time to recover.
There wasn't anything really hard at all about it. There's nothing to it. It isn't pleasant, but it doesn't hurt. There's no pain whatsoever. It's absolutely painless.
So how is it that people can qualify
to become a candidate to have this procedure called external counterpulsation performed for them. But first understand this one basic point. This is a procedure that has been certified and approved by both the Food and Drug Administration, the FDA, as well as by Medicare as being effective for doing what it is that we're talking about doing. That is, to be able to expand the collateral circulation in the heart, the so-called natural bypasses, to try to be able to stimulate them. And it's very effective in doing that, again, even in patients who failed bypass surgery. But who is it that can qualify to get on this machine according to basic insurance company guidelines? And what is it that I recommend? Because there's a little bit of a difference sometimes. As far as I'm concerned, anybody who has documented angina, that is the heart pain of angina pectoris, ought to be able to have an opportunity to be on this machine and to have an opportunity to try to naturally expand their own basic circulation within the heart. After all, if it's successful in 70 to 85% of patients who even have failed bypass surgery, why is it that in addition to anything else that we might be able to offer patients, why would we not want to also try to approach this disease process from the perspective of expanding the circulation, in effect helping the heart to heal itself? Well, that's exactly what my position is. But in order to be able to qualify to be on this machine for insurance company perspectives, that we have to be able to prove that the discomfort that you may be having in your chest is truly related to the discomfort of angina pectoris, and that that pain ought to be of a significant severity level in order to be able to qualify. We've talked about what EECP is, and we've talked about who it is that seems to best for it, who can benefit from it the most. Now what I really want to share with you is what else can we do for patients who have coronary artery disease. What do we do here at the EECP Heart Care Center? EECP, if it's successful, basically buys folks some time. It helps to improve the circulation of the heart muscle, decrease symptoms, increase the activity level of folks, be able to allow them to get back into their normal activities much more aggressively than perhaps they've been able to do in years. But what it doesn't do is it doesn't reverse the underlying tendency that arteries have for developing those blockages. So which of the following risk factors for developing this coronary artery disease do you have? And how many of these have you even heard of before? Certainly some of them you have. Things like hypertension or high blood pressure, diabetes, smoking, elevated cholesterol. How about these? Homocysteine, lipoprotein A, a fibrinogen or C-reactive protein, all blood tests that we like to look for that, if abnormal, indicate a significant increased risk for developing coronary artery disease or blockages in your arteries in general.
A study of the device found that 2/3 of the participants reported they felt better. Most had a lot fewer episodes of chest pain and were able to walk and exercise longer, and they were able to use less medication. And the beneficial effects have lasted for more than a year.
Another advantage of EECP is that it can be repeated if symptoms start to come back. In fact, this was Vertuda's third go-round, and she may never go for surgery at this rate, but she's stable, and every time she gets a recurrence of her symptoms, she says, well, let me go back for another tune-up.
That's wonderful.
So let me summarize for you what our approach here at the EECP Heart Care Center is in the treatment of coronary artery disease. Well, number one is the prevention of it. It is even before you have any signs or symptoms of blockages in your arteries, we like to aggressively identify as early as possible, do you or do you not have any of the risk factors that I just mentioned to you? Now, if in spite of those efforts, or if because those efforts are started too late and you now have a coronary artery disease, then what do? That's when we start thinking seriously about enhanced external counterpulsation as one of the primary modalities, in addition to treating the risk factors as well as treating the symptoms you may have with other medications that are currently available to try to reduce the stress to the heart. But the opportunity to be able to, in effect, stimulate the heart to heal itself, to in effect be able to develop its own natural bypasses, is an opportunity that none of us should miss out on if we have this problem developing in ourselves. And don't forget that if you have coronary disease and you're looking to try to bypass the bypass, and give your heart perhaps the best chance that it has to heal itself by looking at EECP, the natural bypass alternative.
To find out more about the non-surgical natural bypass alternative, EECP, call the EECP Heart Care Center toll-free at 1-866-711-EECP.